Hello, I'm back, and we're going to pick up where we left off talking about CMG, case mix grouping. Okay, again, this is the CMG, the case mix group. So basically what this is, and if you kind of think of it in terms of DRGs or even HCCs, it's a grouping of patients who have similar clinical needs, right? So we can make these adjustments based on these components that we talked about earlier, right? And then we assign, the CMG is assigned, and then we have the case mix index. And again, some of the other components that we talked about, the PT and the OT, these are assessed in the same workflow. In other words, we are looking for each component and why does the skilled nursing facility resident need to stay? What are we looking at? And this is kind of outlined in figure 6.1 in your text. Let's take a quick look at that. And again, you can see 6.1, we have the PT and OT case mix classification. So if we have somebody with major joint replacement or spinal surgery, and they have a function score of 0 to 5, this is the PT-OT case mix grouping. This is the case mix for PT, and this is the OT case mix, and so on. And again, 6.3 covers something in a similar way with speech pathology. Again, it's useful to think of these things as a score. The score relates to the case mix grouping, right? So for instance, now we see there's an increase in people with Parkinson's and other things that affect swallowing disorders. Obviously, that's going to play into the speech language pathology. They have the specialists, the speech pathologists that come in and work with these people. There is a nursing component as well. And again, the use of extensive services, what the patient has. If the patient suffers from major depressive disorder is a big one that determines that. And again, we have scoring based on that determines what level of care the patient needs. There are some adjustments to the nursing component. For instance, there's an adjustment for patients living with HIV, AIDS, and related conditions to that for several years. Now, of course, with the new medications, patients are living longer with AIDS, so that has kind of changed the paradigm a little bit. And again, we see an 18% increase as mentioned in this slide here. And then we have the non-therapy, the ancillaries. So these are things like medications, lab tests, imaging, supplies, and what have you, right? And again, you'll note that there's a point system, right? So basically, the higher the score, the higher the case mix index, then that drives up the utilization of resources, which is reflected in the reimbursement. The non-therapy ancillary costs per day, of course, are higher for patients with AIDS, and this is where the coding comes in. That B20 code that we see for AIDS certainly drives the case mix up. And they have the variable day adjustment as mentioned in 6.7, table 6.7 in your book. You may want to pay special attention to 6.7 and other tables in this chapter if nursing home nomenclature and reimbursement is a entirely new thing for you. Let's have a look at that table right now. And again, you'll note here, variable per diem adjustment. And again, the NTA costs are concentrated. In other words, there's more of them in the beginning of the nurse resident's stay in a SNF. So therefore, the adjustments made from the payment days 1 through 300, starting with payment day 4 to 100, it drops off. So now that we've gotten a little bit farther in the course, it may be useful to think about some of the similarities and some of the differences with the different payment models. With prospective payment systems, they're generally looking at a way of capping patients, right? Capping reimbursement by grouping things into categories. For Medicare Part C, this is the HCCs. For inpatient stays in an acute care hospital, it's the MSDRGs. And then here we have the patient-driven per diem model, right? Which also uses different groupings, the case mix group, what have you. The difference is that this model pays on a daily rate once that group is put together. Anyway, I hope you found that useful. Please stop by office hours if you have any questions about this chapter or anything else related to this class. Bye now.